Okay, so we'll share screen and I will do my best to have the chat open as well as teaching y'all at the same time, multitasking. Haven't done that in a while, but we'll figure it out. And then if you guys want to have your labs, I know I say that each time, like your labs out in any lab that you've done, whether it's a Dutch test, blood work panel, OAT test, GI map, there's little clues that it can give you, less on a GI map and OAT, but more so Dutch and blood work, where it can kind of communicate that information. Okay, so let me get the chat going so I can see it. And if y'all have questions throughout, just let me know. All right, so we're going to start with the liver, then we'll move into the pancreas. So the liver, if you can kind of find your right rib cage, it's going to be sort of, if you were to take your palm and place it over that right rib cage, underneath it. And then also if you were to go under the rib cage and push in, you're going to kind of find the spot where your gallbladder is. But a lot of times people tend to feel that area. They'll say it feels almost like it's tense or sensitive or inflamed or crampy. That's sort of where the liver is. So it's beneath the diaphragm, on top of the stomach, right kidneys, like right to the right side, and of the intestines as well. So it's shaped like a cone. The liver is obviously the dark reddish brown organ that we look at, and it weighs about 3 pounds. So the liver, y'all know I've been studying Hebrew, and the Hebrew word for liver is to be heavy, which is very interesting. That's what it's translated as. And so it makes sense, honestly, why when people's liver starts getting a little bit overworked or burdened, they start literally feeling the heaviness of their circumstance and situation in life. And then it also translates from a hormonal perspective where the actual physical scale starts to go up because the liver is so important for blood sugar balance, hormone regulation. Most of your insulin hepatocytes are within the liver. So when the liver goes, we struggle with weight loss in a lot of ways. So it's ironic that it's to be heavy because that kind of translates in multiple areas throughout the body. Your liver acts as your secondary firewall. So we've talked about your infection markers, white blood cells, neutrophils, lymphocytes, eosinophils, basophils, your cytokine hormones. Your liver is sort of behind those. It's the firewall that is going to detox a lot of the drugs, pathogens, harmful microbial products that might be hindering you or that have snuck past the primary barrier of the gut walls, essentially. And when we are exposed to toxins, your liver, when it's not burdened, can detox it. When someone's on birth control, it's going to almost have to work extra hard. So anytime we put something into our body, whether it's a prescription medication or a personal care product, or that list could go on and on and on, the liver is going to have to break it down either through phase 1, phase 2, or phase 3. And this is also where our liver is capable of doing this. We don't necessarily have to remove everything. In fact, I think that can be a unhealthy way of handling things. You love getting your nails done, get your nails done. Other areas of your life probably look great. If you really want to go get a certain treatment, whatever it is, and you are clean in a bunch of other areas, it's kind of like, I don't want to say pick your toxin, but you kind of get to pick your toxin essentially. And then there's things beyond our control, pesticides on the lawns, things that are in the air, all that. So phase 1 of liver detoxification, I'll go down this picture in a second, but phase 1 is going to be through the cytokine P450 enzyme. And this is going to break down toxins and make them more lipid soluble, or make the lipid soluble ones more water soluble. So it's kind of transitioning these ones that maybe were stored in fat to get converted into water, where then through the elimination process, it goes through the urine via kidneys or sweat. And this is also when we say your toxins are often stored in the fat, that's why. If your liver is stagnant and it can't break it down, then of course these lipid soluble toxins, if they can't be eliminated properly and translated into water, they're just going to stay in the fat, which is why often when people support their liver, the weight starts to decrease. starts to get more into balance. So you have cofactors that are needed for this. Your B vitamins are very, very, very important cofactors. So is glutathione, your amino acids, flavonoids, and phospholipids. Your phospholipids are going to be things like PC and balance oil from Body Bio. Flavonoids are a lot of nutrient-dense foods. Branched chain amino acids are predominantly going to come from meat products. If people are not eating meat, it's going to be really difficult to get sufficient amino acids in their whole form. And then glutathione, there's some precursors to that we'll talk on, like taurine and glycine. NAC is another a really good precursor to glutathione. So that's phase 1. Phase 2 is going to be through conjugation. That's a fancy word for join together. So the liver cells are going to attach a molecule, and this could be the cysteine, glycine, or sulfur to that drug to make it less harmful for the body. So when we look at phase 2 here, the steps are listed. So sulfation, glucuronidation, glutathione conjugation, methylation, that's a word that we've kind of spoken on more recently, acetylation, and glycination. And in this, you don't want the metabolites to stay there for too long, because this is where people don't feel great. This is also where, when we're looking at a lot of y'all's Dutch tests, we start to see issues with the DHEAS molecule. So for example, if someone has a lot of total DHEA, which is made by the adrenals, but they don't have sufficient DHEAS, which is a sulfur attached to it, then they have an issue possibly with sulfation. Now, one of the most common reasons that happens is inflammation. There's other steps in the process too. You can't detox the hormones from your body without methylation. It's a key step as well. And then you also need antioxidants that are going to reduce damage and support the body as a whole. So a lot of those antioxidants are going to be very vitamin and mineral rich, but then you also have like silymarin, which is milk thistle, artichoke extract, schisandra berry. And then you also have things that support the mitochondria and gut, CoQ10, zinc, things like that. So that is phase 1, phase 2, and then it obviously then passes into phase 3, which is through the urine, via kidneys, bladder, sweat, and stool, which is why sweating can be really helpful. And we need proper bile production for it to even make its way to the stool. Your bile is sort of like the water slide where it's transporting the water tube and the person outside of the water tube to get into the pool, which is the stool. Okay. So if we don't have sufficient bile production, which taking too many binders can make that stagnant, not eating enough healthy fat, nervous system dysregulation, because the vagus nerve is what tells the gallbladder to release the bile. All of those could be the root reason why we have an issue. So those are the 3 phases of liver detoxification. So yes, it's a detox organ, but it's also helpful in breaking things down, filtering, so other toxins and organ functions aren't overwhelmed or burdened to actually be able to get rid of them. So that's just a little extra thing on that. Functions of the liver. There's a lot, and we have several slides on functions of the liver, but here's just sort of the medical structure. You have the right side, the left side, the hepatic duct, the cystic duct, the gallbladder, and the liver regulates most of your chemical levels in the blood and excretes bile. Gallbladder stores it. This helps carry away waste products, like we mentioned, and the liver also processes the blood, breaks it down, balances it, creates the nutrients, also metabolizes the drugs. More than 500 functions are currently known. I'm sure there's a ton more. And it also is the site where production of cholesterol and special proteins to help carry fats throughout the body takes place. It's where the conversion, and I have a slide on this later, of excess glucose is turned into glycogen for storage. And then glycogen can later be converted back to glucose for energy. And one of the best foods that can actually help that process is honey. There's so many enzymes in honey, and it's one of the preferred sources of glucose that will just hang out in the liver when we're sleeping. That's a really common time where people will dip in their blood sugar and it'll wake them up in the middle of the night, or it prohibits them from getting restorative sleep, whether it's deep or REM. So honey is something that's really, really good. Another one, and it supports the kidneys, but cherries. Cherries are another really good source because they also have serotonin components to them. So those are two foods where if you're experiencing blood sugar issues in the middle of the night, honey and cherries with a little bit of fat before bed can be really, really helpful. Regulation of blood levels of amino acids, which is why I'll get to the lab markers. You'll see variations in your serum protein, and it's due to liver dysfunction. Tart cherry juice, yep, that would be good too, in addition to cherries. Processing of hemoglobin. So when we did the blood chem video with y'all, we said that sometimes when there's iron issues, whether it's too low or too high, it can actually be a liver problem. Your liver stores iron, and then ferritin is sort of within the cell in that extracellular space inside the cell membrane. Conversion of ammonia to urea. When people start to detox, think about that for a second. You're pulling things from the fat. It has to go through your liver. And all of a sudden they're like, my BO has gotten really bad. I smell. More drainage support, more liver support, more kidney support, more minerals for hydration. It's just basically communicating that things are backed up. Clearing drugs, poisonous substances, regulation of blood clotting, resisting infections by making immune factors, and the clearance of bilirubin from red blood cells. Bilirubin, this is something they'll look at in kids if they come out of the womb and have a yellow tint to their skin or eyes and they're diagnosed with jaundice. And often it's poor clearance of bilirubin. So the liver and the gallbladder play a big role in that. And that's why, like, you can even look at the eyes and you want your eyes very, very white. If they're not very, very white, it can be moving in the direction of yellow, which means we need more liver support. So for the typical human adult, the liver is the largest and heaviest. That was the thing about Hebrew, to be heavy. The liver is one of the primary places where proteins are metabolized. We talked about that. So that also means if people struggle to build muscle, we also have to look at the liver. It's not just a matter of let's eat more proteins, because most of our bodily tissues are made up of proteins, but they are largely produced and metabolized and synthesized and degraded from the liver. The liver is considered the seat of anger, hate, and resentment. It's also tied to feelings of envy, irritability, frustration, impatience, and excessive ambition. Not uncommon to have those feelings sort of surface when you're starting to work on your health. And then the liver is the only human organ that can naturally regenerate lost tissue, which is really cool. It's the most regenerative organ in the body. So even with non-alcoholic fatty liver disease or cirrhosis or areas where the liver has taken a big hit, it can regenerate, which is the encouraging part about it. It's sort of like a starfish. If you cut off a starfish, one of its legs, it'll grow back. I always think that the liver is the starfish. As little as 25% of the liver in a liver transplant can regrow into a full-size, healthy, functioning liver. So that's really, really cool. It really takes a total, just depleted, unwell liver at that point where that transplant would essentially be necessary, but it doesn't take much for a liver to regrow itself like starfish, full-size, healthy, functioning liver. This is the role that the slide I was talking about with glucose. And the reason I wanted to do the liver and pancreas together this week is for this slide specifically. They're very tightly woven and connected when it comes to blood sugar regulation. And one of the reasons I've spoke on blood sugar regulation for so long is because that it has a direct effect on our cortisol levels and our adrenal stress, which impacts our nervous system, which then downstream impacts everything else. It's also why when they've done studies and reviews of people with adrenal distress and cortisol irregularities, balancing blood sugar provided the most support of anything else. High and low blood sugar can often feel like anxiety. and jitteriness and shakiness. And if it's too high, you're going to be overstimulated and your mood will be explosive. And if you're too low, exhausted and jittery. So when we think of this slide here, let's start with just low blood sugar. So these are all signaling systems. Your body perceives low blood sugar. Maybe you haven't eaten in a while, or it's low due to chronic stress. Your pancreas then is going to promote glucagon release. So it secretes glucagon. And then from that, it stimulates the liver to start the process and turning the wheel. It's like plugging a device in to heat it up, to stimulate glycogen breakdown. So glycogen gets converted into glucose and it raises the blood sugar. Now, this is also why when someone works out at a high level, at a high intensity, your body's like, I don't have enough blood sugar in my body. This is why fasted workouts are so detrimental. And it's a stress response. And so the pancreas is like, okay, we need glucagon and I need to force the liver to now stimulate glycogen breakdown to give me fuel to accommodate for this workout. So think about that for a second. If your liver is now having to focus on blood sugar, what can it now not do as efficiently? Break down toxins, eliminate toxic waste, balance hormones. So that's why it's so essential to fuel your body accordingly and try to keep your blood sugar as balanced as possible so that your liver is not having to do this process over and over and over again. It also has another feedback loop. So in the same token, when your blood sugar is too high, your pancreas is going to promote insulin release. Glucagon and insulin are inversely related, sort of like cortisol and melatonin. So that insulin, essentially from the pancreas, as it's secreted, is going to stimulate glucose uptake from the blood. And if you can imagine the tissue cells of your body, and there's a bunch of keyholes on the outside of every cell, and glucose needs to get in those cells where it's needed. If you don't have insulin, which is the key to unlock and allow that glucose in, then what happens is that glucose circulates and then insulin keeps being secreted because the body's like, my cells need glucose. And then you have high fasting insulin and high glucose. So that's the problem with that side of things. And then it also forces your liver to stimulate glycogen formation because glycogen lowers blood sugar, glucose raises blood sugar, and then it also diverts your liver away from its normal function. So that is the cycle of how they're connected. And there's a lot of other functions that obviously the liver has, but this is its relationship with the pancreas. And it's happening all the time, which is why we're so big on tracking blood sugar to make sure that you're not falling too low or spiking too high, because it's going to force this process to happen over and over and over again. Does a Dutch test show blood sugar issues? It doesn't. No, a Dutch test won't really show blood sugar. All right, so liver. A happy liver, we already talked about a lot of the things it does. It also converts your inactive thyroid hormone to active thyroid hormone, T3, activates various enzymes. Those are two things we haven't covered yet. And when the liver is not working properly, we start noticing side effects. Acne, eczema, and skin itchiness a lot of times comes back to the health of the liver. Nausea, headaches, migraines, mast cells, histamine intolerance, chemical sensitivities, hormone imbalances across the board, bloating, gas, leaky gut, low free T3, low thyroid function, tenderness over the right rib cage, and then weight issues or swelling. Those are all indicators that the liver is not doing too hot. It needs more support. And these are the things that tend to burden the liver the most. So poor diet, and that can also be lack of amino acids, lack of meat in the diet that's needed. Alcohol, some people really can't tolerate alcohol. Their body's not great at breaking it down, or a sedentary lifestyle. Heavy metals, they like to accumulate in a lot of those cells of the liver. Mineral deficiencies and nutrient imbalances, because it'll block phase 1 and phase 2 of liver detoxification. Parasites, liver flukes can actually go in, and that hepatic duct I showed y'all in that photo at the beginning right here, that can actually get disrupted this hepatic duct by liver flukes. Pretty gross. So then that's blocking the communication between the liver and the gallbladder. All right, going next to, we already covered that, Glyphosate, herbicides, pesticides, toxins, chemicals, xenoestrogens, mold mycotoxins, EBV, stress, poor methylation, drainage. So with labs, some things that can communicate the liver's not working too great. Your liver enzymes, AST, ALT, and GGT. Now, it can take a 50% reduction in enzymatic function of the liver before your AST and ALT ever change. So those are not the best markers to look at by themselves. Sort of like the thyroid, it takes a 25% reduction before you really start to see the actual thyroid labs go out of range. And so that's also important to recognize. But GGT is more sensitive. So when we start seeing low or high GGT, there's something going on with the liver. It's a really good sign there probably isn't enough glutathione. So you're getting blocked in phase 1 of liver detox. You also need B6 for glutathione and GGT. Another one that's going to go out of range pretty quickly are your lipid panel markers: cholesterol, LDL, HDL, VLDL, and triglycerides. Now, VLDL, the more I look at that, in y'all's initial blood work video, we said, really, you want it less than 15. The more that I have really dove into this, and it's not ever been trained at these conferences or seminars, I think that low VLDL is just as big of a problem. And the reason why is because you need sufficient choline for VLDL production, and your phospholipids are also essential for phase 1 liver detox. So if you're looking at your labs, I really feel like you actually want your VLDL around 12 to 15. You don't want it too high, like above 20. So 15 to 20, you're probably okay, but you don't want it too low. So look at your labs and look at that. If it's too high, it's probably like a blockage or poor fatty acid breakdown. If it's too low, it could be liver stress and not enough choline or PC in the diet to produce enough VLDL needed for phase 1 liver detoxification. Another one we can look at is triglycerides and LDL. So when we eat too much sugar, and I'm not just talking about sugar on a label, but any food that is essentially a carbohydrate, granted, y'all know I love carbs, but it all will break down into sugar. Carbs break down into sugar. So if we have too much in the diet and our body can't process enough of it, your liver is going to make more LDL, which will take the LDL pretty high, 120, 130, 140, 150 and above. Triglycerides is another one that can be influenced from the diet, very much so. Low triglycerides are usually associated with advanced liver issues, or the liver's been burdened for a long time from things like metals and mold, whereas high triglycerides can be a clue for fatty liver issues in general, or insulin resistance. So you really want those triglycerides around, I'd say, 70 to 95. The upper limit's 99, but that's really where you want to fall. You don't want them too low, and you don't want them really above 100. So that's kind of where you want the triglycerides to fall. Your cholesterol can be heavily influenced by a lot of things, so that one's not as great to look at when it comes to the liver, but the liver can influence the cholesterol, LDL, HDL as a whole. Platelets, high or low platelets, because they are infection indicators, can reflect poor liver function. ALK-Phos, we've talked about that as a mitochondrial marker. If it's too low, levels can actually increase with liver obstruction or damage. Ceruloplasmin, this is a copper marker that we look at. So your liver normally takes copper from your bloodstream and it puts it into the ceruloplasmin, but issues with your liver can mess that process up. You also need sufficient vitamin A in the form of retinol to fuel that process. And vitamin A is also essential for the liver. LDH. So LDH can climb and go higher with tissue-wide inflammation or liver problems. If LDH is too low, it's typically if there's not enough calories in the diet or reactive hypoglycemia. Creatinine and BUN, these are primary kidney markers, but they're secondary liver markers. So elevations or decreases in those can reflect liver problems. Glucose fasting insulin, and then protein. Albumin, not so much. Albumin tends to elevate more with cellular dehydration, which comes back to cell membrane, but your protein marker, if it's too low, it's a problem, liver indicator often, and if it's too high, it can also be a liver indicator. And yes, you do get lots of vitamin A from eating organ meats. It's one of the best sources of vitamin A in the form of retinol. Yeah. Iron panel. So your iron can also go up due to viral problems, but the liver can increase the iron. And in the liver, it could be scarring. Cirrhosis is the name for that. An enlarged liver. In serious cases, liver cancer, liver failure, y'all would not be in those categories, or your labs would be all medically out of range. High or low ferritin, because your liver releases iron and ferritin from damaged liver cells. So if you have an imbalanced iron or ferritin, it's a response of your body saying, like, my liver's not happy. There is a damaged cell or multiple damaged cells within the liver, and it's a storage site for it. And then it can influence your TIBC and UIBC. So your liver is like a thermostat for your iron levels. That's kind of the way to think of it as. So if there is problems with the liver, you're not going to make sufficient bile, which helps regulate the pH of the gut, which makes it to where it's really easy for parasites to thrive and toxins to recirculate, and you won't absorb your fat-soluble vitamins. So you'll also tend to see low vitamin D on blood work for the same reason. Symptoms of vitamin A problems or ceruloplasmin problems because copper's not being absorbed properly. And then a lot of aging that you've recognized that's come on quickly because vitamin E is also fat soluble. So those are all things that can be influenced when the bile's not being produced and utilized properly. Prolactin, this is in response to stress usually, but also liver dysfunction. And we also have to think about, okay, prolactin can elevate in situations like PCOS as well, blood sugar dysregulation. Why? All the excess hormones, right? Blood sugar goes off. The body's like, especially in females, I need more testosterone to balance the blood sugar. So cysts, fibroids, all these things form in order to increase testosterone in the body. It'll aromatize into estrogen. So now you have testosterone dominance and estrogen dominance, and all those hormones have to be processed through the liver. And now your liver's overwhelmed and prolactin goes up. So that's kind of what's happening there. CRP, so this is produced in the liver in response to inflammation. Keyword here, CRP, produced in the liver. A lot of times people think of CRP as just body-wide, not always. It's more so reflecting the fact that your liver is involved in the process responding to inflammation, not necessarily that you have body-wide inflammation. It could be any inflammation. It's also why when you're looking at all the inflammatory markers, CRP may be normal, but you see ESR high or something else high, and it helps you kind of narrow down what's possibly going on. You know, ESR can increase, for example, from targeted treatment on the mouth. And so there is an inflammatory process taking place in the mouth and the tissues. And so ESR goes up, but your whole body's not inflamed. And so CRP is normal. And then urinary pH, lower high urinary pH is an indicator for liver stress. Last blood work indicators. We don't run this with y'all very often, but sex hormone binding globulin. This can be high with liver problems since it's mainly produced in the liver. It's also a really good marker to look at if there is thyroid problems. Bilirubin, we kind of already talked about. Haptoglobin, this is grouped into the ceruloplasmin family because it's also a protein made mainly in the liver, and its main function is involved in binding free hemoglobin. Free hemoglobin can be toxic to the body when it's not contained inside your red blood cells. So once it binds hemoglobin, haptoglobin will carry it back to the liver where it's broken down, packaged, and removed from the body. So this marker not only checks for hemolytic anemia, which is the destruction of red blood cells, but it also looks at overall liver function. The only exception to this is it's BFFs with CRP. So if CRP goes up, haptoglobin is going to follow it. High or low red blood cells. In liver diseases, there is an imbalance in lipid metabolism, which results in an accumulation of excess cholesterol in red blood cell membranes. So that can influence the red blood cells. And then your hemoglobin, hematocrit, and MCV, MCH, all of those can be influenced from the liver when they're high. Dutch test, these are really the top ones that are going to show you liver problems. The first one is going to be the marker pyroglutamate. Low or high can indicate an issue with glutathione. So glutathione levels are going to decrease with disease in general. So that pyroglutamate is going to measure sort of what they're doing, and you want that at a solid range. So high or low can point to some liver issues. Higher estrogen or higher in relation to progesterone. And then a big clue is when your 4-OHE1 is at the high end of range or out of range. And it may not always, from a dial perspective, be out of the star. You've got to look at the pie chart on a far side of a Dutch test and look at what the expected percentage is versus the patient percentage. So that's something that is so key. If someone's out of that, then their liver is overburdened. And that in excess is what leads to breast cancer. And what I find really interesting, and I've been speaking to melatonin a lot, is melatonin helps your liver work better and actually shift this 4-OHE1 to a healthy percentage, which inherently is going to do what? Reduce the risk of things like breast cancer. So I always just find it interesting that people are like melatonin is bad and it's just, yeah, no, I think that it can actually be really healthy in these types of situations. It's a way stronger antioxidant than even glutathione. So facial indicators. This week, the main thing I was studying was how the face and hair can point to issues with organ systems, and pretty interesting what came up. So your eyebrows, all of us, if you were to look, have these, not all of us, but I have it on my left side, which is spleen, but there's these 11 lines right here. And the one on the right side is more liver. The one on the left side is more spleen. So my ex-boyfriend gave me 11s. Okay, but think about this for a second, Gabby. Like, think about this. What's the main emotion associated with the liver? Think about it. Anger. Yep. So when we are mad, right, we develop these lines and it's burdening the liver because it's connected. So first time you felt true anger. So people always say that the 11s are both the liver. The more I look at it, because a lot of times people only have one. But the liver and spleen, think about it, they also run together. They are fighting foreign infections. So if you have them, right side 11 line, liver, left side 11 line is spleen. Sometimes people will say that both of them above the bridge of the nose is liver. I think it's more right side liver, left side spleen. And then with the expression lines, when people say they're squinting and stressing, usually that won't lead to just like, yes, but there's a reason you have expression lines, which is usually underlying deep-rooted emotional distress typically, or a root cause that's driving it. So yeah, a super pronounced 11 on the right side is probably going to be a big screaming element for addressing the root and like sitting with the Lord on, hey, what does he have to say about possible anger or things that I haven't worked through, and liver stress. Forehead crease. So a crease in the forehead center can either be from excessive fat in the diet and food intolerances, or the inability to break that fat down, which comes back to the liver, because we need to be able to make bile to break down fat in the diet. So the forehead crease, sometimes people will just have one, but they could have multiple too in lots of areas. This is honesty hour, one of my biggest insecurities. As y'all know, I was diagnosed with autoimmune hepatitis. So my liver's under constant just burden and beat down. That's why I high dose my reishi a lot, because I tend to get these lines on my forehead. It's like the area that lines like to form. But what is interesting is when I support my liver more, I do notice that they fade more. So super interesting. All right, frown lines. So a deep frown line is frequently found also with those who either suppress their anger or get angry quickly. Eyeballs. So a white ring bordering the colored part of the eye can be a sign of fatty deposits caused by high cholesterol, which comes from a burdened liver. A reddened sclera, I think it's pronounced sclera or sclera, could be an indication of high blood pressure. And then the yellowing of the eyes could be an indicator of jaundice. I was about to ask about fading. My husband said my forehead wrinkles look gone. That's amazing. Hope for all of us. Mine do fade when I support my liver a lot. Like if I'm notorious about using castor oil packs, I swear it makes a difference. And taking my herbs. So that's super cool. All right, left cheek. I don't know why it's the left cheek, but it is. The left side. Broken capillaries and redness, especially up next to the bridge of the nose. It could also be like excess heat, inflammation, or congestion of toxins in the liver. It's hard though, because if you sleep on your left side and your pillow's dirty, that could be another reason. But if you've had areas in your left cheek and not your right, something to think about. And then the chin. So your chin and your jaw is often due to liver stagnation. And your liver is the crossroads and junction of all hormones. So when we start to break out here, yes, it's hormones, but we have to ask, okay, well, why are they out of balance? And usually it's liver stagnation. So interesting. I have this in the left cheek, but not the right. Okay, so it could be pointing to liver. Super interesting. So those are facial indicators. Supports. We'll get to supports. So magnesium. This is a really big one. Supplementation can not only preserve liver function, but can also slow the progression of liver disease and reduce the mortality associated. Selenium, I love selenium. We're putting that in our newest supplement, has been shown to improve liver function by reducing serum AST and ALT levels. Molybdenum, this is a cofactor for the sulfate oxidase enzyme, which converts sulfites into sulfates. So earlier when I mentioned, and look at the next line, if you are very sensitive to alcohol or you get really hungover from alcohol, you could actually have a molybdenum deficiency. On a Dutch test, what you'll tend to see with that is the DHEA higher, where the DHEAS is lower. And molybdenum is a really good support for that. It's also an ingredient in biotoxin binder. So biotoxin binder is essentially helping the process of sulfation, AKA your liver phase 2 detox, which is often why people get hungover because their liver is stagnant. Zinc, this is a pivotal role in enzyme functions. It serves as a cofactor for methylation, which is crucial for optimal gut and liver function. Chromium, this is good for blood sugar, balances metabolic and clinical markers in non-alcoholic fatty liver disease as well. Magglycinate, my favorite. I think Pure Encapsulations has a good one. But I also like Magnesium Breakthrough. It's got the 7 different types of magnesium. Additional nutrients, we want to make sure we're getting enough of our amino acids and vitamins and minerals. If you've done a scan, sometimes a lot of y'all will come up with methionine, and that is step 1 in methylation. And it's only available really like in quantity doses animal products, and you have to be able to break it down, which you need hydrochloric acid for and enzymes for. Protease is another big one. So that's another thing where, you know, getting into a rest and relaxed state to make enough stomach acid to break that food down. If it makes you bloated, then you're not breaking it down. Rhodiola, this is an ingredient we chose for stress control. It helps with insulin resistance and blood sugar. And in cell studies, it activates a protein called AMPK. This is a metabolic switch, which increases your insulin sensitivity, which is really, really cool. And when you do that, you're going to prevent fat buildup in the liver as a result. So people with diabetes, insulin resistance, love rhodiola rosea. Sweating, castor oil packs, coffee enemas, these can all be great. I would not overdo the coffee enemas. I think people do those too often, and it's just dumping the liver, and the other systems can't efficiently remove it. So please don't do those like 4 or 5 times a week. I think that's too much. Taurine, and then taurine is also needed to make TUDCA. Schisandra, love Schisandra. I don't know where that chemicals came from, but one is more prone to conditions like gallstones from chemicals. And so I think that this was supposed to say horsetail. So horsetail is found in Drainage Essentials. Inositol for blood sugar balance, artichoke leaf extract. This is also in drainage. It protects the liver from damage. It also increases the production of bile, can help the liver cells regenerate, and has been studied to balance a lot of your lipid panel markers. Food supports: meat from amino acids, beets. Beets are probably one of the best foods for the liver. So if nothing else, if you could get some beets, and if you're like, I can't eat beets, then beet juice or beet powder, it's so good for the liver. So good for the liver. You'll also have purple urine for a little bit and purple poop. Olive oil, carrots, garlic, ginger, avocado, green tea, turmeric, artichoke, omega-3 fish, dandelion, especially in tea form, drinking warm lemon water first thing in the morning with a little bit of sea salt, and ghee of all things. So ghee is the easiest fat for the liver to digest, and it can also help to restore enzymatic function. I don't know if y'all remember, those of you that were at the Cellcore Eco Conference in 2021, and I showed the case study of the acne and the face. And what I had her drink every single morning, and it's still what I do all the time, is a King coffee with ghee and sea salt. And it completely helps, even like if you study traditional Chinese medicine with the gut and balancing the system, but it's because getting your blood sugar balanced in the morning requires healthy fat often, and ghee is one of the easiest fats for the liver to digest. So it takes the burden off of it having to regulate insulin and blood sugar, and it also takes the burden off of it having to digest the fat. So I had her do 2 tablespoons of ghee. I would work up to that, but it's just very healing and very good for the gut for restoring the enzyme function. So big fan of ghee. Big fan. Big fan. If someone has a dairy sensitivity, it's usually parasites, Emily. So it just depends, or they don't make enough lactose. But a lot of times people can do ghee and no other dairy. So just give it a try. Okay, so that's the liver. I think someone asked about brown spots. I think brown spots is more advanced with the liver, but there's other things that can contribute to brown spots as well. People could also make a case for melasma, but that's a hormonal imbalance. So a lot of times it's hormone issues. So yeah, the liver could play a role. Okay, pancreas. So this is an organ in the back of your abdomen. It is part of the digestive system. It is an organ and a gland, and it performs 2 main functions. Your exocrine function is to produce enzymes that help with digestion, and the endocrine function is what sends out hormones, glucagon and insulin, that control the amount of sugar in your bloodstream. So those are the 2 main functions of it. We already kind of talked about that, but here is a little chart of where the pancreas sits in the body. If I zoom in here, you can kind of see where it's at. So if you're kind of finding your sternum and you go down, it's right sort of below that sternum area and a little bit to the side. So you have the body of the pancreas, you have the tail of the pancreas, you've got your pancreatic ducts, you've got the duodenum of the small intestine that sort of wraps up next to it. And then you've got your abdominal aortas and inferior vena cavas and bile ducts that sort of are connected there. So this also plays a really large role and is sort of connected to the gallbladder. So, well, not connected, but you have your liver here, gallbladder, and you can see where the pancreas sits. So it's kind of beneath the stomach. If you were to see the backside, it's also connected to the liver. Signs and symptoms of pancreatic dysfunction. We've got abdominal pain, back pain. It can mirror some of the kidney symptoms at the beginning: nausea, vomiting, loss of appetite, oily or fatty stools, nutrient deficiencies due to the lack of enzymes for digestion and absorption, and blood sugar issues. So some signs and symptoms or things that can cause pancreas dysfunction. Number 1 would be stress. We've talked about stress enough. Impacts blood sugar. Pancreatitis. This is the redness and swelling of the pancreas. It can be sudden or it could be chronic. This could be alcohol abuse, toxins, poor drainage, gallstones, trauma, medical or mechanical obstruction, infections, autoimmune. Sometimes people have hereditary pancreatitis. And then the post that we did on gallbladder can help connect dots as well. So when the gallbladder goes, the pancreas tends to follow. So there's more stress stuff, glyphosate, that can impact it. Viral infections, those can play a role. I have a sweet, sweet, sweet client I've been working with who's a teen, and her mom came to me and asked if I would help her daughter. She was diagnosed with type 1 diabetes at a very young age. And I've just sort of started scratching the surface of all of her medical records. Her mom sent me this massive binder of literally everything. But right now, a lot of what it's pointing to is that last little bullet point here, which is EBV. A rampant case of it. So we know that a lot of people have it. It's just a matter of, is it causing a problem or not? But it disrupts cellular functioning. So anyways, I think that plays a role in type 1 diabetes. I think it's why we're also seeing a ton of type 1s post-COVID. Mold and mycotoxins, there was a study. It wasn't a big study, but they saw 5 new type 1 diabetes cases developing in patients heavily exposed to indoor mold in occupational medicine practice. This was a doctor that did just kind of a, let me just go out and find what this is causing. Certain fungus that moves from the gut to the pancreas, expands their population. Heavy metals, so toxic heavy metals are going to induce oxidative stress, which is directly related to damage to the pancreatic beta cells. Arsenic poisoning is one of the causes of pancreatitis. Cadmium can affect the pancreatic beta cells and glucose metabolism. So when we talk about like what's the main root cause of type 1 diabetes, it could be a combination of any of these or a bad case of one of them. Poor diet, that does play a role as well. Excess high-fat foods, simple sugars, those can increase the triglyceride levels. This then boosts the amount of fat in your blood, increases the risk of acute pancreatitis. Research also shows that processed meat, and when I say processed meat and red meat, it's the bad types of proteins and the way it's typically cooked. So processed meat would be your hot dogs, things like that. Blood sugar handling issues. So we already kind of talked about insulin and the role of that, but ideally, fasting and insulin levels should be ideally 1 to 5 for someone who still has their pancreas. If they have their pancreas removed or they have type 1 diabetes, that's going to look a little bit different. And then inflammation. So this is going to lead to a variety of inflammatory disorders like pancreatitis. Currently, there is no cure for reversing type 1 diabetes. Nothing that we are aware of, in not just we, but anybody. Stress, same info there. Lab indicators. So bilirubin. Bilirubin is going to be a really good indicator for pancreas problems because typically when gallbladder goes, pancreas goes, high GGT, so not low, but high. It can be low if there's a glutathione deficiency or B6 deficiency, but typically in situations of pancreatitis, like massive pancreas problems, you're going to see high GGT, high LDH, BUN tends to be low, gastrin tends to be low, vitamin A tends to be low. If you were to run amylase or lipase in the blood, those tend to be out of range as well. They help look for inflammation of the pancreas. And then blood sugar irregularities. That's glucose, hemoglobin A1C, uric acid, fasting insulin. Supports, so reducing stress by slowing down, doing better at doing less, resting, chewing your food well, cherishing it, relaxing while eating makes a massive difference in your body's ability to produce the enzymes that break it down to be able to digest it. Eating as organic as possible to avoid glyphosate, lots of antioxidant-rich foods, avoiding excess alcohol. Some have to avoid it entirely until things settle and their liver isn't as burdened and gallbladder isn't as burdened. Gallstones. So this is a big one. If those are present, and it says work with a practitioner, because I know that there's like those liver and gallbladder flushes, but I think you got to be careful with those because if a gallstone is too large, like there's been several clients of mine who are like, hey, I was told I need to have my gallbladder removed. And I'm like, you need to get an ultrasound. And I mean, their gallstones were so large that if they were to try to do a flush, there could be a blockage. So that's where you'd want to dissolve them first before you were to ever consider a gallbladder flush. Ozone. So ozone can help break down glyphosate. Glyphosate can impede pancreatic function and tracking blood sugar. And then last but not least, we've got garlic. This is not only good for parasites, but it can help in reducing toxicity of the pancreas. Herbal supports, licorice, mullein, peony, uva ursi, ginger, and schisandra are all really good ones. Taurine, this has beneficial effects for acute pancreatitis. turmeric, Indo Supreme from Supreme Nutrition, Pancreas 10, that's a mixture of enzymes produced by the exocrine cells of the pancreas. Pancreatic enzymes, these are going to be amylase, lipase, and protease. And then support for root causes, as y'all are doing, working through the roadmap, supporting foundations as a whole. So that is liver and pancreas. Do y'all have any questions? Do you want me to go back to anything or questions about your own labs? Yeah, go ahead, Emily. Beef liver. What about it?
I have a quick question on Kings.
Go ahead.
Do you know why they're delayed right now with all their orders?
I'm pretty sure it's delays coming in from the ships.
Oh, I didn't realize it comes from overseas.
Yeah, it comes from overseas, and then there's a 14-day quarantine period where they do all the testing. Yeah. So to my awareness, that's why, unfortunately.
I have one packet left. I'm so
I ran out like 4 years ago, and I was like, this will never happen again. So I have my emergency stash just in case.
Oh, I should do that. I didn't order soon enough. I usually have like 3 extras on hand. But...
I know my dad called me too stressing. He was stressed. He was so stressed.
I've got a quick question too.
Yeah.
Smart out. Did we do prolactin like on the basic blood panel?
I don't think it's on the basic one.
Okay, it's on a different one.
Yeah, I think it's on a different one. I think it's on the Wellness Plus panel.
Okay, good to know.
Yeah.
And then this is kind of off topic, but what do you think about vitamin E supplementing? Because that seems like that's been coming up lately that I've been reading.
I don't love it, to be honest with you. And the reason why is because if you start supplementing with vitamin E, you can start presenting with symptoms of a vitamin A deficiency.
Oh,
And so, yep. And so then also why I don't love supplementing with the fat soluble vitamins as a whole, unless you really know what you're doing, is then taking that can displace and disrupt calcium and vitamin D. So I know that a lot of times like people will take, I think it's called PUFA Protect. Is that the name of it? It's like a vitamin E supplement.
Yeah.
I'm not convinced yet. I think if you're going to supplement with them, there is a biotic supplement that contains all of them called like emulsion. Y'all know what I'm talking about? Biotics, emulsion, it combines them all together. Something like that. It's got multiple types in it, but if you're going to supplement with fat soluble vitamins, I would do them all together. So don't take vitamin E isolated, take it with A, D, and K.
Okay.
Okay, I'm gonna try again. Can you hear me,
Yes.
Okay, sorry. So I don't know if you remember with my last consult, but you had me on beef liver and we were gonna try the gummies with like the gelatin, and I started to eat meat, but basically we said that I'm probably anemic, even though you don't diagnose anemia. My ferritin was 10.
Yep.
I've run out of most of the supplements, but I still have the Take Sumi, which just lasts forever, but I do take it. Which my question about that is that a binder, and should I not take it if I'm like basically out of the other things? Because all I have left now is the Happy Bees and the molybdenum.
Yep.
So I'm finishing those, but I wasn't sure if I should keep taking the Take Sumi, and I also wasn't sure if I should continuously take the beef liver.
Yeah, beef liver is good to continue taking. And Take Sumi, I like for people to rotate on and off of it. Like don't take it every day for the rest of your life. But it's good, like especially as they're spraying more chemtrails above our house every day.
So is it basically a binder? Is that the main reason you take it? The
Yep.
Take Sumi?
Take Sumi is a binder, but it also reduces the burden on your organ systems.
Okay. I was just wondering, like, the thing that we were working on besides the iron was mold. And so I know that was part of the reason that you take a binder. So then I guess my question was like, do you continuously take the binder even when you run out of the mold thing? Because we obviously need to schedule our next plan, but
Yep, you do, until you finish
Okay.
it. Yeah,
okay, cool.
Yeah.
I just wanted to make sure I wasn't like finding nothing, you know what I mean? Like, so,
for
okay,
sure.
thank you.
Yeah.
Oh, I know, sorry. So beef liver, you said stay on, but as far as I feel like I asked this last time, but I'm not sure that I understand it. Like, at what point do you think like, okay, my anemia is maybe getting better, or is that something I should be testing labs for to like see progress?
Labs.
Yeah. Okay,
Labs.
got it. All right,
Yeah.
then I'll just send you a message to schedule the next thing.
Perfect.
How do you, I saw that with the Takisumi that you take it continuously. How do you know when you need it? Cause I had a really weird experience today. I was having like all kinds of, I don't know if it's like detox or what it is, but I was like feeling like the worst I had in a long time. And I hadn't taken it in a few days and I took it and it helped a ton.
Yeah, it's because there's chemtrails everywhere. In the
That-
sky.
that makes
And
sense.
just, chemical spills and, things in our water, all the things. So I just rotate it. I go through a container, like I go through 4 or 5 containers in a year.
Just good to keep on hand.
That's what I do. If I go out to eat at a restaurant, if I travel, if I go on an airplane, you know what I mean? It's just
Yeah.
security blanket.
Good to know.
Yeah. Good questions. The pills are good too. Yeah. I also really like using Takisumi occasionally. Like if you think about its properties, like a little bit on a toothbrush, brush your teeth with it, brush your tongue with it. I think a lot of times the oral hygiene gets forgotten about when it comes to overall health. So that could be a good way to use it too. I know some people even use like as a charcoal underarm armpit detox thing. Also, that random long link I put in the chat is the Bio AD EK emulsion. That just drops to water. So if y'all are wanting to supplement with vitamin E, I would do it in a combo like that personally. Any other questions about liver or pancreas? I think Gabby's comment wins the night. My boyfriend gave me 11s. So great. Taksumi does not bind to other nutrients. In fact, Dr. Noah did a training for us in the practitioner group and said that all the doctors he's worked with, they've had people on Takisumi long term, and it didn't affect any of the micronutrients. Just take it 30 minutes before things or 90 minutes after. Kind of a good rule of thumb. It's okay, Gabby. We're all gonna work on our anger and our liver, and they'll just even out. That's my goal, because I don't want Botox. I've been like sitting doing like gua sha, facial massages, like breath work. Like, this is not good. Would sharp pains in the liver likely be due to liver flukes or toxin overload? It could be anything from that list, anything that's influencing it, or it could be gallstones. I think castor oil packs are good for that too. Anything that's blocking it, interfering with it, even scarring, pains could also be from like it being enlarged. I do have them. Look. Yes, I do. Look. See, they're there.
When you do that.
No, my family, we went to Fogo de Chao last night and they took a family photo. I don't know if y'all's moms ever put pictures of you on Facebook that are just so bad. And it had me and my stepdad at the front part of the camera and everyone else at the back. And they looked like they were shrunken. And it looked like me and my stepdad got blown up.
Yeah.
And it was the word. She put it all over Facebook. It was like lovely. I texted my friends the photo. I said, please tell me this is not what I look like in person.
It's amazing how the angle can do that.
Oh my gosh. It was like such a bad picture.
Yeah, we're so vain.
We are. But I also was like, my stepdad was closer than me and he looked 800 pounds. Okay, Gabby, will you speak to what you just said? I've never heard of that. what facial massage? What are the names of those?
Oh, they're just women that that's hilarious. They're just women. Those are Instagram handles.
I'm like, what is that?
Skincare. Yeah, it's not this technique. Noise Skincare and Kosha Spa, they're Instagram handles, and they have just so many facial massage techniques. And when I do them, it's
Makes a
wild.
difference.
So different. Yeah.
Okay.
Yeah.
I have to implement more of that in my life.
Mhm.
And gua sha too, because it feels good.
Yeah, gua sha too. They both use that. And I know you have, do you have the facial cups?
Yes, I love those. I do those a lot.
Mhm.
But like your forehead doesn't have a lot of skin. So like I'll do the cups in this area, but like your forehead, it's hard.
I know. I think that one of them has talked about the forehead lines, and I can't remember who. It might be, her name's Donna from Noise Skincare, and she also has like a facial reflexology tool that I think she uses. But yeah,
That's
trying to
cool.
avoid the Botox for sure.
I think I might actually, and I'll teach y'all if I learn. It's not acupuncture, but my friend Steph uses it. We used to do needling for injuries in college, where like if we had an injury in our shoulder, they would put, it was also the functional medicine doctor office I work at, that you would needle to certain areas and it brings like tissue healing and collagen to that area. And if y'all look up online, like needling on the face, you see all these needles and it's for wrinkles. Like there's an actual thing that you can go to. There's none in my area. There's a lot in California if you're out in California, but they don't even call it facial acupuncture. There's like a specific name for it. And they do it in like for wrinkles to just like calm. They do it on the scalp too, because sometimes your scalp tension, that's why they like massaging, can be the cause for like lifting in areas. It's fascinating. Wilding has demos. I have their tool, their gua sha tool. Yeah, lasers are great. I love how this was liver and pancreas and we're talking about wrinkles and skin. Of course we are. It's okay. It's good. It's all good things. Any other comments, questions?
Wait,
Things?
I'm so fascinated by the face thing because I
know.
developed this long line like only on my left side, and so many of my things point to liver. I say this all the time, but probably from binge drinking as a child, but not a child, as a teenager.
Yeah, let's be clear.
But it's so the left line you said indicates more liver.
Well, I think
need?
in the 11 area.
Oh, in the 11 area.
Yes.
Okay. What about the cheek? Didn't you say something about the cheek?
Yeah, the cheek, the left cheek, I don't know if it's the line, but the left cheek can also point to stagnation. So the left cheek was, nope, that's not it. Broken capillaries and redness, inflammation or congestion of toxins in the liver. That's
Yeah,
left.
I have like one broken capillary on my face, and that's where it is. So that's so interesting.
Liver. I'm
You
telling
should
you,
do
a lot of stuff points to liver. Like anytime we see hormones off, liver. Mood changes, liver. Lack of digestion, liver.
I think I need a liver transplant.
No, you don't. They told me I'd need that. Can you imagine? Fresh out of college, they said I need to get on the liver transplant list.
So crazy. I feel like if I would have gotten true labs, because I had like jaundice and everything,
So did I.
probably around the same time as you. Yeah. And like,
Yep.
So crazy.
Yep. There are solutions where I need a liver transplant and yearly hepatitis vaccinations. That was their two
That's so
solutions.
crazy, because that's the time that I was starting to work in the hospital, and I had to get 3 Hep B vaccines and my body wouldn't take it. I should have just been like, there's a reason that like the titer won't turn up.
Yep.
And that's when all my stuff started.
Yep.
Like,
Can y'all imagine? I'm sitting there and like I didn't know what I know now. Like it's like 2017. I'm fresh out of college. And I'm looking at the best, like he's the best liver doctor in Texas. And we just got my biopsy results back. And he's like, okay, yeah, this isn't good. You need a liver transplant and you need yearly vaccinations of Hep B. And I said, what are my other options? He goes, there aren't other options. I looked at my mom and said,
you're gonna die.
we're leaving. We're leaving. I don't believe him.
Wow.
And I was like, I don't even
Okay,
drink
you
alcohol.
know.
How is this possible?
You should write him a letter.
I know, sir, you were
Oh,
wrong.
man.
I know. I know. It was rough. And then 2 weeks later, Hashimoto's, double whammy. It's all right. What doesn't kill us makes us stronger. I think.
And the lines on your nails, that's liver, right?
It can mean a lot of things. Are you talking about the vertical ones or the horizontal?
The vertical, like they're more ridge.
There's like a
lines.
specific nail for it. So Terry's nails. So Terry's nails is a symptom of either diabetes or liver problems. If you look up Terry's, Terrys,
I guess once you have that, does it ever resolve itself?
it will.
Oh, okay.
Yeah, it will. Just like all the specs, which a lot of them can be zinc,
Hmm.
and then it can resolve once you address the anemia.
Gotcha.
Yeah. Also, I don't know if y'all have ever seen the tongue. This will be the last thing before we close out, but have y'all ever looked at what the tongue can mean? If you're all going to be like in the, here, I'll pull up several pictures. Okay. The tongue can mean so much. If you like in the first thing in the morning, look at it. Okay. So if you see variations or imbalances in certain parts, it can point to different organ systems. So heart, lungs, spleen, stomach, pancreas, intestines, kidneys. Like, I think that's so wild to me. Like, I wonder if brushing your tongue helps, but I bet like tongue scraping, I know that helps. So there's that photo. And then there's also this one. There's also different colors. Like, so a pale tongue can point to something. This white one would be like candida. If you have
My acupuncturist also said, like, not just these images, but also if you see, I think she said like dents in your tongue, like on the side, for example. I think she said that's fatigue.
Wow.
Which is interesting.
But like crazy that our tongue of all things.
Yeah, because she asked to look at it every time, and I finally asked, well, what do you see? She's like,
Yeah. I've really been thinking about that lately. Or like, what are the things that might be my post for later? What are the systems, or what can our hair and our face and our nails and our pulse and all these things, body temperature, communicate? Like non-lab indicators. Because I think there's a lot that we don't even know yet. Like, why does certain muscles get stiff? You know, like we learned in the NTA that a tight IT band is estrogen dominance. Like, I'm sure there's so many other things. Yeah, Markel.
Whatever shoulders, I've been struggling with that for the last 2 days.
Shoulders.
It's been excruciating. Like in my
Shoulder.
neck, the back of my neck, down my shoulder. I've been stretching it so much, it's crazy.
Have you used arnica gel? That might help.
No, what is that?
Use arnica gel.
Arnica? All right, I'll
Yeah.
look it up.
Arnica gel might help. And a posture corrector. That might help too. Tongue scrape. Yeah, so good. Okay, I think that's everything. A split nail, I think that's nutrient need. Did I answer everything? Okay, cool. All right, so I will see y'all next week. We will continue our organ series. I don't have organ systems picked out for next week. Are there 2 that y'all want to do that we haven't done yet? Any that stick out? The ones
have you done, I'm assuming this is an organ, the brain.
we have not done it to its entirety yet. It's been very like basic. That's a big complex thing.
I just thought of it because I was listening to the call again from last week when you were talking about PC. And I'd be curious, like more in depth, how that affects everything.
Brain would be good. I was honestly though thinking like even right now, the ovaries and that system,
Yeah, awesome.
reproductive system, ovaries, bladder. That could be a cool one. So maybe we'll do that.
Sold.
Yeah, might change my mind, but for now, that's what we'll do. All right, well, I will upload, or I'll send this to Al. She'll have it uploaded, and we will see y'all next Monday. Have a great week.